Ed, thank you so much for joining us for this interview because I really want clinicians to get a sense as to what it's like to go through the process of being in a place where you're a clinician but you're not providing services from a distance and feeling kind of unsure about it, taking a training, having your first sessions, and now being in a place where telemental health counseling is a part of your practice. So you've been there, you've done it. So I would love for you to share what that's been like for you. So to start, Ed, if you could introduce yourself and share a bit about your experience as a clinician so far and especially prior to beginning providing telemental health services.
Sure. It will be my pleasure, Ray. So this is Ed Glauser. I'm a licensed professional counselor in Athens, Georgia. I've been counseling for over 26 years. I've been a part-time clinician doing private practice, group practices. In the past, I've worked in inpatient treatment settings, but I've also been a full-time school counselor throughout the 26 years and since I've gotten my graduate degree in counseling. And I would say the first 25 years of my career, I thoroughly enjoyed it, but then I reached a ceiling in terms of what else do I do in terms of my clinical practice, and I was aware that I wanted to reinvigorate my practice in some way. And so one day I looked in the mail, saw a postcard from Ray Barrett and the Telehealth Certification Institute, and I thought, why not? This is exciting. I want to continue this career. I want to continue to be hungry and enjoy what I'm doing and serve clients. And this seems a cutting-edge way to reach new people, enhance the work I'm already doing with my current clients. Let me find out more. So that's when I signed up for your face-to-face training a little over a year ago, and then I did part of the training online. So the combination of the face-to-face and the online training was just excellent, and it did over a year later. My practice has been totally reinvigorated. So I thank you for that.
Oh, that's awesome. That's great to hear. So it sounds like it was perfect timing for you, and to get that postcard in the mail. And now it's awesome to hear where you are now providing the service. Before you got started, did you have some apprehension? Did you have some concerns, questions? What was that like for you?
Well, I knew there was going to be a steep learning curve in terms of how do I do telemental health counseling. And the first thing I thought of, it would be like, video conferencing, and I think I can do that. But having taken your training, I saw there was so much more that I can do besides video conferencing. I can do texting, emailing, all through secure and encrypted portals. I can also enhance my practice management by making it all electronic and making all my communications with my clients secure and encrypted, where I didn't know I was doing anything wrong. I just didn't know. So being able to kind of be ahead of the curve with since I'm in Georgia, the telemental health rule, when it took effect this October, I was ready. I was good to go because of all the training I did with you. It was so comprehensive, and I enjoyed it so much that I wanted to get that distance credentialed counselor, the DCC, to make me even more competent and credible. So your training, I think, is only one of 3 in the entire country. Your way of being, your accessibility, your professionalism, you really provided a consummate training, and I developed a wonderful professional relationship with you. So you came into my professional life at just the right time, and again, I'm grateful.
I'm really glad to hear that. So the training helped you really gain that confidence. And then how did you get started?
Well, really, through the training, you prepared us in terms of practice management, how to do video conferencing, how to communicate in secure and encrypted ways. There was a lot of technology issues that required a lot of learning, a lot of focus, a lot of engagement. There was a lot, and you also gave us the confidence to say, start out little by little. Do what's comfortable for you and see how you can become more competent in your own way, at your own pace, and I loved your approach. So for me, I decided to get my feet wet after the training and doing those wonderful role plays in the training with getting on to a service called Breakthrough. And Breakthrough, pretty much everything is done for you. They will do the technical IT team will walk you through sessions before you actually do sessions through video conferencing. So that was a wonderful way to get started, to get my feet wet. And little by little, I gained confidence, and then I expanded my practice. So over a year later, I feel like I'm pretty competent. But it started out with just Breakthrough and getting my feet wet with video conferencing, and then I expanded it.
Yeah. And now you're using a practice management program, right? For the texting, well, you're using a texting program, you're using a practice management program for all of your medical records, for the video conferencing, for secure messaging with clients, for your scheduling, for your billing. Is that right?
Correct. That's right, and that's the other thing about your training is you gave us a lot of exposure to a lot of different practice management portals, texting, email apps, everything, and then I found what worked for me. So in my own example, and this won't work for everybody, but it worked for me beautifully, is I learned about this adaptive telehealth. Also, I know there's Counsel, there's other practice management systems, but adaptive telehealth worked beautifully for me. So I can do a lot of integrative electronic record keeping, billing, video conferencing, emailing, but then I also supplemented it with some other things. For example, texting, I use ClickSoft, and that is one of several secure and encrypted texting. I also use Hushmail, and Hushmail beautifully supplements how I communicate through adaptive telehealth, that practice management portal, through enhanced emailing and doing the emotional bracketing and the descriptive imagery. So, I mean, I'm so excited about this. After a year, I know there's still more to learn, but it really has, again, invigorated my practice, made it more integrative, more state-of-the-art, so I really feel like I can grow in the future.
Yeah. So you really wanted something different. You wanted to move forward, and you simply did it. You took a training, and after taking the training, signed up with an online program that could feed you some clients and just got started. Had your first session, got comfortable, and just kept going with it. And it sounds like it's been a lot easier for you than you thought it would be. It's actually been exciting to use the technology and has really helped your practice.
Right.
Is
at
right?
first it seems daunting when you learn all of these different aspects of telemental health counseling. But if you start out little by little, you first get on a video conferencing portal, then it's much easier than I would have anticipated. You provide so much information, so much coaching, that really you can vastly enhance your practice electronically and through video conferencing, but it's good to do it step by step. And I did that step by step for about 6 to 8 months, And then I really grew even more confident where this is totally integrated into my private practice.
That's great. It's awesome to hear. And the clinicians that are watching this, what would you recommend to them? Clinicians that also are interested in being able to offer more services to their clients, help their clients overcome obstacles to being able to get help if they have transportation issues or they're looking for a specialist, or if the clinician themselves wants some more flexibility in their own schedule. So they're interested in getting started. What would you recommend?
Well, I would recommend that they learn everything they can through you, through your training, and they will find their way. And it's a way, really, that I was able to have greater continuity with my existing clients where transportation or weather could have been a factor, so we're not missing sessions. There's more compliance. I'm able to develop a new client base with distance clients. Some want to see me face-to-face at first, and then we switch to video conferencing. So there's lots of different ways that you can integrate distance counseling into your practice. The clinician really needs to decide for themselves what will work best for them in a sequential, step-by-step manner. And that's what I did. Again, at first the information, there's so much, but it's so enriching, it's exciting, and little by little you learn more and more, you get more confident, and it's really one of the most exciting things I've ever done in my professional life. And again, I've done this for over 26 years, and listen to my enthusiasm. Mm-hmm. So this is something that, as I get older,
that is something
that it's going to be very easy for me to continue working with clients because of mobility issues or whatever. This is something that I'm going to use for many years and decades to come.
Mm-hmm. Yeah, thanks for sharing your process, with all the clinicians listening, from beginning to end and where you are now and your excitement and enthusiasm. I really appreciate you, sharing that process with everyone. So thanks a lot, Ed. That's been very, very helpful. I'm sure clinicians listening to this will really hold on to those, all the different aspects that you shared with them in your advice. So thanks a lot, and I look forward to our further conversations.
Thank you so much, Ray, and good luck to everybody. It's been a pleasure.
Good, thanks. Thank you. Bye-bye.
Bye-bye.